السلام عليكم. صوتي واضح؟
وعليكم السلام. واضح.
حلو، تمام. نبدأ إن شاء الله. تمام، يلا بسم الله إن شاء الله نبدأ. السلام عليكم ورحمة الله وبركاته. أهلا ومرحبا فيكم جميعا. معكم غيداء القرني Resident Matched at Women's Health Hospital التابع لوزارة الحرس الوطني. بداية حابة أشكر تواجدكم، وإن شاء الله بإذن الله أنكم تستفيدون اليوم وأجاوب على كل أسئلتكم. طبعا زي ما هو واضح من التايتل، التوك mainly focused on the OBGYN internship rotation، يعني للانترز أكثر. لكن في كثير من الادفايس اللي راح أعطيه throughout the presentation يعتبر general advice و advice that you can apply actually to any OBGYN clinical experience. يعني حتى أنتم يا students اللي بتاخذون OBGYN rotations or clerkships راح تستفيدون من كثير من الادفايس اللي راح أعطيه throughout the presentation. الشيء الثاني اللي أبغى أقوله إنه the presentation is very very friendly، ف nothing formal. If you want to jump in, give any questions, give any opinions, have any feel free. الشيء الثالث اللي هو أبغى أذكره إنه كثير من الأدفايس والتبس والتريكس اللي راح أقولها based on my experience و experience of others. feel free to adjust the advice and the tips according to you and what you see is suitable for yourself، لأن each person is different. Each person has their own experiences and own situations. put this in mind. تمام. وآخر نقطة، sometimes I talk too fast or move through the presentation a little bit too fast. if you feel that, give me a heads up ولا أعطوني خبر بس إنه I talk a little bit slower، وبحاول إن شاء الله إني أخلي الموضوع أبسط وأهدى. طيب نبدأ إن شاء الله. طيب في هذه البرزنتيشن في البداية راح أعطيكم introduction، بعدين راح أتكلم على كيف we set goals for your OBGYN rotation. Then we'll talk about these unspoken rules. After that, we're going to talk about the tips and tricks, highlighting your strengths, and finally advice for specific centers. And by the end of the presentation, we're going to have a Q&A session. Okay? So نبدأ بسم الله. طيب الحاجة اللي حابة أنوه عليها إنه the journey to get matched in OBGYN depends on several factors. ما هو factor واحد. عندنا your rotations and electives, that's one of the factors. Your cumulative score, which includes your SMLE score, your CV points, and your GPA. وبعدين عندنا also the interviews and your final CV. All of these can play factors in your matching in OBGYN. الموضوع اللي راح أركز عليه اليوم هو كيف to utilize your rotations in order to gain the most benefit from them. تمام. Most universities give 2 mandatory OBGYN rotations. It differs from university to university, but most of them give 2. بعدين عندكم also the electives where you can take them as also in OBGYN. You're increasing your OBGYN rotations throughout the year. These are examples of the months you're going to take OBGYN. We're going to talk about that mainly in this presentation. طيب, the first step in your OBGYN rotation is setting goals. أنا أشوف إن هذه من أهم steps. Most of us do set goals unconsciously. يعني قبل ما نبدأ الروتيشن نفكر إيش راح نسوي وإيش نبغى نسوي، بس we don't actually sit down and write those goals down. I believe it's very important. I would suggest that everybody writes down their goals for that month. And the goals can differ. I've written some examples that you can have as goals. أول goal ممكن يكون learning about the specialty. A lot of interns are interested in OBGYN, but they're not sure if they actually want to pursue OBGYN for their future career. So you can put that as one of your goals. And if that is one of your goals, you need to make sure that you're visiting all departments of OBGYN, from the labor and delivery room, to the clinics, to the ORs, to the in-ward, and the ER. Visit all parts of the departments of OBGYN. تمام. الشيء الثاني you need to ask. Not only asking residents, because residents are tired a lot of the time, but it's important to take their opinion about the specialty. You ask junior residents, you ask senior residents, you ask fellows, you ask associates, you ask consultants. So all of these people you need to ask to have an idea about the specialty. It is important also to have نقدر نقول a neutral opinion about their opinions about the specialty. Try to be neutral and take what's benefiting you as a person. Okay. A second goal could be getting to know the center and its environment. Some of the people already know OBGYN is my future career. I already know. I've tried it in summer training. I've tried it before. I want to pursue OBGYN. So one of the goals could be before starting your internship rotation is getting to know the center and its environment. So to do so, you need to also visit all the departments. You need to ask the residents there, what do you believe is the advantages and disadvantages of your center? Do you think that you're gaining enough skills and knowledge throughout your residency training? So get to know the center more and get to understand whether or not this center is best for you or not. So this is an example of a second goal. A third goal could be increasing your chances to get accepted in the center. So maybe you already know the center. You've already tried it before. You're sure that you want this center as your future center. So you want to know how can you increase your chances to get accepted in that center. And if this is one of your goals, then listen up because I'm going to be talking more about it in the coming slides, okay? A fourth goal could be gaining specific skills. So, for example, you want to increase your skills in physical examination or ultrasound or in surgery or a certain surgical skill. So if that's also one of your goals, write it down. These are examples of goals. One of these could be your goal. All four of these could be your goal, an extra personalized goal. So this is not the case. The case is just you need to have your goals ready. And I believe this is the first and most important step. Then we move on to the next part of the presentation, which is the unspoken rules. I call them unspoken because we should all know them. And I think we all know them by now. But there is no harm in repetition and just reminding ourselves with those rules. So first rule is punctuality. Punctuality is very important. You need to come on time in clinics, in morning meetings, in rounds, in ORs. Make sure to be ready on time. This will show that you're a dedicated person, you're a professional person, and it is one of the most important things. As interns, sometimes because we don't have that much of a responsibility, we can come late sometimes. Try to avoid that as much as possible. It won't make you look good at all, okay? The second goal or rule, sorry, is professionalism. Be professional in the way you act, in the way you talk, in the way you look. It is very, very important. Responsibility is also a very important rule. A fourth thing is being well-mannered. And I think we all know this. Not only well-mannered, but to the residents or to the consultants, you need to be well-mannered with everyone, including your fellow interns, including students, including nurses. It really shows when a person is truly well-mannered or not, and try to make sure to always be a well-mannered person. Fourth thing or fifth thing, you need to be prepared. And I mean prepared as in, if you have a surgery, bring the scrubs. Bring whatever is required from you. Don't come leaving anything. Try as much as possible to be prepared always. If you have a surgery, read about that surgery. Try to prepare a little bit. So these are things that will show that you are a person who's willing to learn and is up to learning. Okay, so these are the unspoken rules. Now we're going to move on to the tips and tricks. Okay, first tip, and I think it's one of the most important tips, is consistently introducing yourself. I mean, whenever you visit anyone, resident, consultant, fellow, associate, nurses, introduce yourself, introduce your name, tell them that you're interested in OBGYN, tell them from where you are, let them know you, okay? Never come and go without anybody knowing who you are or just knowing you as the intern. Let them know your name. And I just want to give you a heads up. It's okay if you tell them your name and then 30 minutes later, the consultant asks you, who are you? It is totally normal. Don't take anything personally. They see a lot of people throughout the day. They see interns, they see residents, so they will forget your name. It is your role and your job to constantly remind them who are you and that you're interested in the specialty. This is the best way to make them remember you, okay? Second tip is build connections with residents and other residents. Yeah, residents are very helpful. They will guide you throughout the way. They will guide you throughout the rotation and after the rotation. So make sure you have good connections with residents and try to make them know you and you know them so that they can help you later on. Third tip is do some action, not only observership. I know this is a little bit of a hard tip or trick because as interns and as students, I know that OBGYN is not the easiest specialty to be involved in. It is a sensitive reproductive system, and not all patients are willing to allow students or interns or trainees to examine them or take from them history or whatever, but try your best. Try your best. In clinics, utilize them as much as possible. Ask the resident, what can I do? Can I do a GPS swab? Can I take a speculum examination? And try your best to be involved. I mean, for interns, you can do GPS swabs, you can do speculum examinations, you can do ultrasound, try at least, and under supervision, obviously, but try to be involved. This will help you and help people around you to notice you. In the labor room, You can deliver the placenta, you can deliver the baby under supervision, but I mean, try to ask the resident or the person you're working with, can I be involved? Can I do this? Can I do that? Try to work a little bit. In the OR, scrub in, come prepared. As I said before, if you come prepared, if you come revising the scrub technique, if you come ready to do something, they will allow you to do something. In the ward, you can do a lot of things, including taking history, seeing postpartum patients, doing some examinations. So these are things you can do in the ward, okay? Fourth tip, and this is one of the greatest tip I followed, make your questions ready. Whenever you have a question throughout the rotation, you'll have some questions popping in your head. Whenever you have a question, write it down. You will need it later. When the consultant turns and asks you, do you have any questions? And you say, yes, I do. This will tell or give it a sign to the consultant that you are willing to learn, you are thinking, you're making your questions ready. So whenever you have a question, just write it down and use it whenever you need it, okay? Fifth tip, stay the full time in on-calls. On-calls can be long. On-calls sometimes can be boring. Not boring, but you feel that you don't have a big role in the on-call and you'd rather go home and sleep. Never do that. Try to stay the full time in on-call. Even if you don't believe that you have an active role in the on-call, you will benefit from that on-call. I mean, on-calls are the best opportunity to see cases, to network with residents. Most of the residents I got to know were during the on-calls. When you sit together, when you eat together, when you eat lunch or dinner, and you speak together, they'll ask you, from where are you? Why are you interested in OBGYN? Where do you want to apply? They'll get to know you. And this is a very good opportunity. You'll get to know consultants during the on-call. They'll get to ask questions. They'll ask, who are you? You're part of our team in the on-call. You'll say yes, and they'll get to know you better. So this is also a very important tip. Sixth thing is recommendations and references. Try your best to get recommendations throughout your rotations. Most consultants will give you recommendations. Some consultants will prefer giving you recommendations if they see you a lot. So see consultants. I believe the best time to have one-on-one conversations with consultants are during clinics. So attend clinics with consultants, talk to the consultants, tell them that you're interested in OBGYN, let them know you, and then ask for that recommendation. This will make it easier for them to say yes to you. References, I mean, this is mainly for a person who actually knows you. I took my references from my university assistant professors and from the people I worked with in research and in rotations. So take it from someone who actually knows you, because they will call them later on. Okay, seventh thing. Write down important details you may forget. During your rotation, you will see a lot of interesting cases, emergency cases. Write those cases down. You will need them later, especially in interviews. Some centers do ask you, have you encountered any memorable experience during your rotation? Have you seen any emergency case during your rotations? What was your role? How were you involved? What were the steps that were taken during that emergency case? So write down any important event you find during your rotation so that you remember it later on. Write down the names of consultants you attended their clinics with, or rounds, or ORs. Write down the names of residents, because they may ask you, who are the residents you worked with? Who are the consultants you worked with? So it's normal to forget. Just write them down so when you need them, you have them, okay? This is a very important tip. Eighth tip, attend all department activities, morning meetings, mock exam activities, symposiums, whatever the activity is, try to attend it. When you attend it, they'll know that you're someone not from their center. You're someone new, and they'll ask, who are you? And when they know you're the intern with them this month, they know that you're someone who's active, who is most likely willing to learn, willing to attend activities. And this is a strong point for you, okay? So this is in regard to the tip-centric. Moving on to the next part, and I believe a lot of people don't focus on this part as much, which is highlighting your strength. كثير من الانترنز ما يركزون على نقاط القوة اللي هي عندهم. كل شخص عنده نقطة قوة أو عنده شيء يميزه عن الآخرين. Ask yourself, what am I good at? Regardless of the thing, try to highlight it during your month. And I'll give you some examples. يعني مثلا, you are a leader, okay? You just like to have that role, you have that quality. So try to be a leader during your month. If they ask who wants to lead the interns, raise your hand. Who wants to be the leader of the group, raise your hand. Make them see that you're actually a good leader. This is one of the strengths you can highlight. If you are, for example, have a skill like graphic designing, Try your best to highlight that during your month. You may feel that this is something unrelated to the specialty, but no, some centers are actually interested in residents that have multiple talents. So design something for your department, or show them your work. If you're a good researcher, show them your research, talk about your research, or even start a research if you have an idea. Okay, you can even participate in making a journal club activity, choosing an article and critically appraising it. Okay, if you're good in surgery, for example, make sure not to waste any surgical opportunity. Go into ORs, so show them the skills you have. This is one of the strengths that you can highlight. If you're good at reading, discuss the articles you've read before. If you're good at presentations and teachings, make sure to make a teaching activity or present the topic in the morning meeting. This will show them that you're also a good academic or good teacher. So if you're good in medical knowledge, discuss the medical knowledge. These are just examples, and the list goes on. You just need to focus on what strengths you have and try to highlight it during your rotation. Okay, another common question. كثير من الانترفيوز يسألون is medical knowledge important? We can divide medical knowledge into two groups: basic OBGYN knowledge and extra knowledge. Basic OBGYN knowledge هو النولج اللي ندرسه في الكلية، هو النولج اللي ذاكر له في الأسمبلي exam. As an intern, you need to know that knowledge. And it's okay if you forget it, but at least revise it before or during your rotation. They will ask you some questions, and some of the anatomy questions or physiology questions or basic history taking questions, you should at least know. This is in regard to the basic OBGYN knowledge. In regards to the extra knowledge, اللي هو knowledge في articles or في journals, or knowledge اللي resident level or consultant level knowledge, you're not obligated, and they know that you're just an intern, you're not supposed to answer those questions, but it would be so good if you can. And it will show that, and it will make you stand out if you can discuss in those topics. So if you want to stand out, try to read a little bit. Read in the American College of Obstetricians and Gynecologists, read the guideline. If there's an interesting case you faced, read about it and come the next day and discuss that topic. So it will show that you're a reader and you're a learner, and it's very interesting. There are common repeated questions. I tried to gather them. These questions are, it's not limited to this, but I just, this is from the top of my head, what questions that they could ask you during your rotation, okay? So the first thing is the delivery ward. They'll definitely ask you about the stages of labor. They'll definitely ask you about what are the signs of placental separation, what is the management, the active management of third stage labor, how to read a CTG. These are very common questions. In the OR, they can ask you what are the layers of the anterior abdominal wall that we will face during a C-section. In the clinic, they can ask you what are the things we're expected to see on the ultrasound in each trimester. And they can also ask you, if you're, for example, in an MFM clinic, they will ask you how to diagnose a GDM or how to manage a GDM. So these are examples of very common repeated questions toward interns. So moving on to the last part of the presentation. I'm not sure if we still have time, but if it closes, we're going to open a new link. Okay. So to get accepted in a specific center, do all the previous tips and tricks. And these are some additional tips and tricks that you can follow. First of all, if you want a specific center, read about that center. Most centers have websites. Read about the history of the center, the building, where is the center located, how many departments for the center, where is each department located. This will save you a lot of time on your first day of the rotation. So have an understanding about the center. Ask others about that center. Some centers are looking for specific things in residence. What are the things you can do that will allow you to get accepted in that specific center? So ask and look for those things. Find out important names. This is the second thing. Before going to your rotation, if there's a specific center in mind, know important names like the RTP's name, the chairman's name, the chief resident's name. These are very important names, and you can find these names on the hospital website, in LinkedIn, in Twitter. I mean, even if you find a photo, that would make it much easier. You can know that person right away. You need to communicate with these people. You need to encounter them throughout your rotation. These are the people who are going to be responsible for your acceptance. Not necessarily, but the most important is the RTP and maybe chief resident. Let them know you. Let them know that you're an interested, hardworking, future resident. Okay, so this is also very important tip. So in general, do your homework before going to that center. Okay. Third thing is work extra hard. I mean, you should always work hard, but if there's a specific center in mind, work extra hard. And what I mean by that is come very early and stay more hours. If you have an on-call, stay as much as possible, as I said, after the on-call. You can see more people even. Do extra work if there's anything extra you can do. Do research activities. Try your best to work extra hard and show that you're a hardworking person. Fourth thing is, as I said before, networking with residents and consultants, but you need to, even if you can't take contact information from residents, that would be even better. Taking their phone numbers, if they allow you, obviously, or their Twitter accounts or their emails, so that you can contact them later on during the interviews and during the acceptance process, because you can, this will allow you to ask them about important tips they have for you, important advice they have for you, what questions they would ask in the interviews, how to prepare your CV. So if you have any type of contact with residents, that would be great. Fifth thing, also references and recommendations from that exact center would also increase your chances of getting acceptance. So the list is not limited to this, but these are the things that I have in mind. So this is the end of my presentation. I hope it was a very quick, understandable, and very beneficial presentation. إن شاء الله إنكم استفدتوا يا رب. If anybody has any extra questions, I'm open to having the questions, and I'll try to answer as much as possible. You're welcome, everybody.
Thank you so much, Ghaida. I have a question I wanted to ask you.
You can, yes?
Yeah, regarding the interviews, what do you think that the most thing they focused on during the interview for the residency program were? Like, what were the most important questions that you need to prepare to answer?
Okay, this is a very good question. Actually, interviews and the CV is a topic on its own. I mean, if I'm going to talk about the interviews, that would take an extra 20 minutes. So I didn't talk about it today, but that's a very good question. It depends on the center. There isn't one specific question, but there's a group of questions that is going to be asked from each center. And that includes, why do you want OBGYN? What makes you suitable for OBGYN? Why do you want our center? These three questions are going to be asked in every single question, in every single center. Okay, so you can put these in mind. There's also a lot of files that we residents and interns prepare from the repeated questions throughout the year. I mean, if you just prepare well for the interviews are from the, most fun experiences ever. When you actually want the specialty and you're actually interested in it, it makes it even easier to respond to those questions. So these are just examples of questions that they ask, but generally speaking, it depends from center to center, but there are common questions too.
Thank you so much.
You're welcome. Okay, Shema asked, can you talk more, speak more about your experience and how you chose the center you are currently in? So I think choosing the center depends a lot on your priorities. Each person has different priorities. Some people would prefer a center that provides more skill training than knowledge training, and others would choose a center that gives more knowledge training than skill training. So it depends on you. I tried my best to choose a center that provides both skills, knowledge, research opportunities, and academics. I'm a person who's interested in academics and activities. So I tried my best to choose a center that would provide me with that too. Also, choosing sometimes centers that provide you with an optimum exposure of patients. Some people would prefer a center that is less amount of exposure and a calmer, we can say, environment. And other people would prefer a hectic environment. So it depends on you very much. For me, I wanted exposure was one of my important things that I was looking for. So I chose a center that has a good amount of exposure, had all the subspecialties from UroGYN to IVF to MFM to general OB. I wanted to be knowledgeable in all aspects of OBGYN. So this is another thing I focused on. So other people would compensate for the low exposure of their hospital by taking external rotations in other hospitals. They would say, I would prefer a calmer area, and then I would go out to another hospital when I wanted more exposure. So it actually depends on you mainly. But these are the main criteria I looked for in my center. There are any other questions? I'll be happy to answer. I hope that I answered all the questions. If there's any more extra questions, or we can close the session. You're welcome.
Thank you so much, Doctor, for your time. Really appreciate this. I just want to tell everyone who has joined today, if you would like to join our group, go ahead and join using the link in our Twitter account. But other than that, thank you so much again for your time.
Oh, you're welcome, everyone. So then I think we're reaching the end of our, oh, we have an extra question. Let us read it. Are there any recommended resources or study techniques to maximize learning during, okay, this is a very good question. So I actually focused mainly during reading on the SMLE files. I was busy with studying for SMLE. There's already an I think you're already familiar with it. Dr. Wafa's OBGYN file is more than enough. She covers most topics in OBGYN. And at that time, I was reading that file. You can also go back to books or textbooks. I had several textbooks, including Williams' textbook. It's a little bit more detailed, but whenever I wanted to have a comprehensive idea about the topic, I would go back to Williams' textbook. I would go back to my university textbook, which is Beckman textbook. Also, I would go find certain articles on the internet, like American College of Obstetricians and Gynecologists. I would write the topic and then write beside it ACOG, American College of Obstetricians and Gynecologists, and then write free article. You would find the free articles on the internet without even signing in, and I would take an overview about the idea from those articles. Yes, Zainab. How did you choose this specialty? You mean specialty? What makes you sure if you got? Okay, so I think you mean how did I choose the specialty, OBGYN as a specialty? This is also a topic on its own. Choosing OBGYN depends, I think, mainly on your personality and on what you're looking for in a specialty. If you're a person who wants for a variety of things to do, from surgeries to clinics to procedures to a variety of things you do throughout the day, then OBGYN is definitely a great specialty. OBGYN is a specialty that focuses on women and women's health. So if it's something that you're interested in, it's also something that you should look in. The topic of delivery and the feeling of reward is great. I mean, I'm a person who's mainly driven by rewards. So if I like to see deliveries, I like to see successful stories, I like to feel that I'm a person who've achieved something throughout the day, then definitely OBGYN is something you have to consider. But I mean, it's a topic on its own, and it has its disadvantages, it has its downfalls. You need to look into it, I mean, carefully and answer it. Answer that question. Just 1 minute. Yeah. So the attendance link is sent on the chat. If anybody wants, regarding the attendance certificate, you can fill in the form. It's sent in the chat, everybody. You're welcome, Zainab. Yes. So as you can see in the slide, this is my account. If you want to contact me on my DMs, I'll be happy to answer any more extra questions. My final advice to you is enjoy your experience. I mean, internship can be hectic, can be tiring, can be stressful, but try as much as possible to enjoy your rotation, enjoy your experiences. It will be very memorable later on. And have fun, be willing to learn. And this is the most important thing. Thank you, everyone. I hope you gained as much as possible. Thank you. We can end the session now.